Today we'll be discussing the topic of suicide with Dr. Daphne Korczak. This is Doctor versus Comedian. I'm Dr. Asif and this is the Doctor of Laughs.
Not a real doctor.
Ali Hassan. Now, every episode, what we normally do is I pick a topic for Ali from comedy and entertainment and I question him about it. Then Ali picks a topic from medicine and health and grills me on that topic. But today's a special episode. In this episode, we'll be discussing suicide with our special guest, Dr. Daphne Korczak. Now, we know this is a sensitive topic, but it has been a topic that's been requested several times by our listeners, and we wanted to make sure we did it justice. Hence, we're inviting really an international expert on this topic. And so we are very interested to hear today what Dr. Korczak has to say about this topic.
And before we welcome her onto the show, just remember, if you are in crisis or you're concerned about somebody who might be, you can text 988 in the US or Canada, or you can visit prevention.ca. Let's not delay anymore. Let's welcome our guest. Daphne Korczak is the Sick Kids Chair in Child and Youth Medical Psychiatry, director of the Children's Integrated Mood and Body Depression Program called CLIMB, senior scientist at the Sick Kids Research Institute, and associate professor in the Department of Psychiatry at the University of Toronto. Her research activities focus on depression and suicide prevention among children and adolescents, the association of adolescent onset depression with premature cardiovascular disease, and novel interventions to decrease suicide risk and improve both depression and cardiovascular health outcomes. Dr. Korczak also leads a large collaborative initiative examining the impact of the pandemic on the mental health of children with and without pre-existing mental health conditions. She's also the author of over 100 publications and book chapters and is a sought-after speaker on the topics of depression and suicidality among children and adolescents for clinical and research audiences. And we are lucky enough to have her here with us right now. Hello, Dr. Korczak.
Hi, Ali. It's nice to be here. Thanks for inviting me.
Now, you and Asif have a pre-existing friendship going back many years, so it's very difficult to balance the Daphne from his side and the Dr. Korczak.
I was going to say, I may call you Daphne, if that's okay. I don't want people to think I'm being offensive. It's just because we've known each other for 25 years.
A long time.
I may dip into a Daphne from time to time, just out of association. I've known him a long time, and the friend of your friend is your friend.
It's fine with me. I would just say that people often devalue mental health physicians. So it depends. I don't know how your audience is, but people do sometimes write it. Like when we've done other interviews in the past, sometimes people get a little bit shirty about that.
Oh, yeah. Our audience is the type to write in. That's exactly who our audience is.
And I would say physicians who are female identify as female. Also, sometimes my wife, who's a physician, who Daphne knows, her colleagues will be Dr. So-and-so, and then they'll call her by her first name in a meeting or even in a professional symposium, right?
Yeah. I mean, I'll be honest, it doesn't matter to me, but I do know that sometimes happens. And if you want to, I don't care.
Yeah. Well, I mean, that's kind of why I mentioned it off the top, because I think we have some listeners who might care for that exact reason also that Asif just suggested. I don't want to diminish any of your accomplishments, especially after that bio that I just read. It's clear how accomplished you are. I do want to start off by diving into sort of an origin story. This is interesting work you do. I imagine it's not easy for you to keep yourself in a positive frame of mind all the time. I want to ask about your background and how you became involved in studying suicide.
Sure. Yeah. I started out actually doing pediatrics, and as a pediatrician, became really interested in mental health and feeling like I needed to understand that a lot better, feeling there was a lot of need there, and moved into psychiatry and did extra training to become a psychiatrist. And then started studying depression initially, because we didn't have a lot of depression research in Canada, and certainly not clinical research in depression. And it was really through that I started to think more about the suicidal thoughts that some depressed youth have and how to address them. And I would work sometimes on the inpatient unit where children might sometimes be hospitalized because of their concerns around safety and really feeling like we needed to better understand, we needed to have better treatments to try and help these kids and families. And that's sort of how I became interested and started working in the field.
I work with the CBC from time to time, so I get language guides sent to me. So I have seen this sort of evolution over the last few years as well. And just before we get into the subject, I've noticed we now say died by suicide, and that's very prevalent in the news. Can we talk about that shifting language a little bit? Do we still use terms like suicide, attempted suicide?
Yeah, you're right. I mean, the language has changed, and I think patients have really helped us to understand how to change our language. I don't know that it was ever, maybe quite a long time ago it was, but certainly not in recent memory has ever been intended to be negative or pejorative or anything like that. But I think unintentionally, sometimes the language has been hurtful to patients and parents. So we've learned from that, and that's sort of how the language has changed. So in some places, still, but certainly more commonly in the past, taking your own life was against the law. It was unlawful. It was criminal. And the term committing suicide was sort of equated with committing a crime and recognizing that that's not appropriate. And the language has changed from that to what is probably a little bit more neutral and reasonable. When people, unfortunately, tragically at times will die by suicide.
Daphne, how often and how common is it to see suicide and attempted suicide in children and youth?
Well, I work at a tertiary care hospital. So I work at Sick Kids, which is a place like many other hospitals with an acute care department, the emergency department, and a child mental health department. So people will come there because of concerns around safety or self-harm. And so because of that, we will see it more commonly, but we do know that it's something that has increased in Canada over the years as well. Like thoughts about dying and thoughts about self-harm have increased among youth in Canada and around the world, actually, over the last number of years.
I actually want to ask you about that, Daphne, because I think from what I've read, and I don't know a lot about the subject, but the risk factors for suicide are complex. So what puts children and youth at risk for suicide, and how have those risk factors perhaps changed over time?
Yeah, it's interesting. And suicide is one of these problems that you're exactly right. It's a complex problem. It's been a difficult problem to solve. And it is sort of a problem that affects people at different life stages, youth, adults, older adults. And I think in general, in pediatrics, sometimes, especially more in the past, we've had to extrapolate a little bit from adult research, adult understanding of illness, only to find out later that that's not appropriate. Children aren't little adults, and we need to treat them differently. And suicide prevention is one of those areas where children and youth really are different from adults and older adults. And we need to be sort of thoughtful around the developmental considerations. So some of those risk factors that might apply to adults and older adults are not quite the same. And so I'm really glad you asked that question, because I think it's important for us to understand that youth suicide may be a little bit different than thinking about suicide prevention in adults or older adults. So for youth, what we have seen is we were making some progress, actually. We did see a decrease in suicide rates and in suicide attempts, hospitalizations for suicide, up until about 2008, 2010. And then at that point, we started to see sort of a bit of an inflection point. We started to see an increase again. And that's sort of been the same. We think about self-harm, but we also think about death by suicide. And that's a similar pattern that is seen in not all, but several countries around the world, this gradual improvement and then worsening again in the rates. And I think why that is a really good question. There's been a lot of speculation. Several things have come up, people have talked about. It's hard not to notice the introduction of the iPhone, the introduction of social media, and those influences, which came around that sort of same time and have become increasingly prevalent, especially among youth. Children younger and younger are now using social media, using various forms of electronic communication, and also looking at social media. And that's a whole other conversation about social media, probably, but why social media might be impacting thoughts of distress and self-harm. We've also seen an increase in the rise in mental health problems in children over the last number of years, especially depression. Depression prevalence rates have increased, and depression is a significant risk factor for suicide and suicide thoughts. It may be partly that people are more comfortable talking about depression, talking about mental health problems in children, so we may have some increase in detection. But in any case, we are seeing higher rates of depression in kids. That also plays a role. And then there are other reasons that people have wondered about, but again, these are sort of theoretical. Is there an association between certain substances and substance use, an increase in substance use over the last number of years? So there are a number of factors that may be at play here. Certainly, the pandemic didn't help. And as a result of the COVID pandemic, we did see a real increase in distress among children and youth, for sure.
You mentioned a couple of things just there, and they were in your bio as well, and I definitely wanted to touch on these. Non-medical folk have said this for a few years now. We won't know all the effects of the pandemic on our kids for years to come. This is what many people say. You're studying those effects, particularly as they pertain to depression and suicide. So can I ask you directly, what was the effect of the pandemic on suicide rates in children and youth?
Sure. Yeah. And you're right. I mean, we've now studied a large group of kids in Ontario. Our results are aligned, consistent with findings from other parts of Canada, the US, and globally. The pandemic was bad for children, that we saw an increase in distress and an increase in depression, and we saw prolonged distress, right, over the course of the pandemic. The same was true for suicide attempts. We looked at, in a study published in Lancet Psychiatry 2023, I'll have to actually check that year. We looked at changes in emergency department visits for suicide attempts before and during the pandemic, sort of from 2020 to 2022. We looked at over 11 million emergency department visits around 18 countries in the world. And we saw there was a 22% increase in suicide attempts during the pandemic compared with before the pandemic for children and adolescents. And that's sort of over and above the upward trend that I was already talking to you about that had already been there before the pandemic. And I think what was even more sobering was that that was in the context of an overall decrease in emergency department presentations for other physical health conditions. So it's not that people were just coming to the emergency department more in general. They were coming to the emergency department more with acute mental health concerns, safety concerns for children and youth. So we definitely saw that that has impacted. Now, the most recent data does take a little bit of time to sort of be collected and analyzed and published. And so I think you're quite right when we say that it will take some time yet to understand what happens to those rates, and hopefully we'll see them decrease. But in terms of the pandemic effect, it certainly increased children's acute distress.
While we're on this subject, you're talking about people coming in distress. I want to ask you from a real practical standpoint, if the child of a parent says, I hate my life, I want to kill myself, how do you handle that? There's certain kids, certain parents who might be like, oh God, there they go again with the, over dramatizing. And then there's certain kids, certain parents where it's like, let's go see a mental health therapist. And then there might be situations where you drive to the ER immediately. What are the general guidelines about that kind of thing? When do you take it seriously? When do you not? Or is it always taken seriously?
Yeah, I think that's a great question. And when a child says they're thinking about ending their life, they're thinking about dying, that's in general, a very scary thing. That's a serious thing. And I think it's the kind of thing that will strike fear into the heart of just about any parent when they hear it. And so it's important to take it seriously. And that is something that your child is trying to express. I think that they are feeling seriously distressed and they are trying to find the words to explain how distressed they feel. Sometimes the challenge with the word suicide or something like that is that it's a bit of a conversation stopper. People can freeze in that moment, just being so frightened or unsure of what to do, that ends up inadvertently becoming a barrier to having a conversation rather than a facilitator of a conversation between a parent and a child, because parents can be so just frightened in that moment. And so I think we have to realize that when a child says that, they're trying to communicate that they're really distressed about something. So they are really very upset. And this is the time to sort of stop and pay attention, whatever it is that's going on in the moment, and try and understand what it is that your child's trying to tell you. And so it can be difficult because, as parents always want to solve problems, right? They sort of want to jump in and solve a problem, fix it. But in this case, this is a time when you really want to try and understand your child's experience. What is going on? How are you feeling? Not to comment on it, not to evaluate it, not to judge it, not to fix it, but just to try and understand it. There's something very powerful, I think, for all of us as human beings, just feeling understood. And so to be able to understand what is your child's feeling, to validate that emotion, and then to be able to say, okay, I'm glad you told me that. Thank you for telling me that. And to, express some of the things that I'm sure parents will want to express in that moment, right? I love you. That would change me forever, and, you're not alone in this. You can talk to me about anything, whatever it is. I'm here, and let's think about what's going on and what's going to be helpful. And so I think that is, in the moment, kids are trying to communicate something. In the moment, parents want to understand and validate how upset they are, and then think about what is the next thing to do.
As you mentioned this, Dr. Korczak, I should also reiterate that if you are in crisis, if somebody is concerned about somebody, you can text 988. This is something I didn't know about. You text 988 in the US or Canada, or you can visit prevention.ca for more resources. As you bring it up, I think, I don't think there's too few times that we can mention that, just in case somebody is.
And there's, and that's what parents might do in that moment. And then what they might do after they have that conversation in that moment, and think, we want to notice, how does the child feel with this conversation? How do they feel about, how safe they are? Do they feel that they need some extra help with that? And then as a parent, you need to decide, have I been seeing things change? Do I think this is in the moment and they're feeling much better? Do I feel that, things actually are changing if I think about it? I am seeing them not wanting to, see their friends when they invite them to somewhere. Am I seeing them kind of being in their room more often? Am I seeing them, seeming to be unhappy more generally? Do they need some extra help? And should that be from your family doctor first? Should that be at school? Should that be in the emergency department? It really does depend on the particular situation.
So with regards to that increase over the pandemic, was there a difference between males and females?
There were definitely differences. One thing that we saw was that there was a more marked increase in girls compared with boys. And that's something that we see broadly in youth self-harm, is that rates of self-harm and suicide attempt are much higher in girls, although rates of death by suicide are much higher in boys. And that's sometimes thought of as a gender paradox in youth suicide in particular. And, we have to think about that carefully, because these rates in girls are increasing and have been increasing more recently, sort of trying to understand what is it that's happening for girls, that they are presenting more commonly and more often than boys, even though still the rate of death by suicide is higher among boys. We're not seeing them in the same numbers that we might expect compared with the girls. I think that there are a number of factors there, but they're important for us to be aware of. I think when we think about outside of the hospital system, when we think about in schools and in communities at large, that girls may be more comfortable talking about their feelings in general compared with boys. Girls are more comfortable asking for help sometimes than boys. Girls are more, for some of the mental health risk factors like depression. Depression is more common in adolescent girls than it is in boys. There may be a bit more risk factor. There may be other factors like the increase in social media and the way that girls use social media compared with boys that may be factors. But we do need to think about not just what are the drivers that causing girls increasing distress over the last number of years, but how can we also help boys? How can we help the boys that aren't, you're talking about their feelings, that aren't coming to the emergency department, but still die by suicide? And so that is something that we need to think about preventatively. We probably need to think about quite early on. And maybe as a society, we intentionally or unintentionally encourage girls to think and talk about their feelings more than we do for boys. Maybe that leads to boys thinking that it's not okay to admit to thoughts of hopelessness or sadness, or maybe even if they think it is okay, they're not quite sure who the person to turn to is. And so I think we do have to start, that is something that starts pretty early on in childhood. And we have to think about the messages that we send to girls, but also to boys around talking about feelings and seeking help when they're feeling distressed.
Because obviously this topic, it instills a lot of fear in parents, especially patients as well. But, and that's what Ollie was kind of getting at with some of those questions. So you've talked about, some of those avenues, whether it's through the school, a family doctor, etc. And is there anything else that can be done with regards to suicide prevention as a big concept?
That's a great question. I mean, it's always better to address the upstream drivers than to try and put efforts into treatment after the fact. So absolutely. I mean, and there are things that parents can do, and there are also some things that, parents need some help with that, schools can do, communities can do to try and work towards preventing kids from getting into that place in the first place. And so some of the drivers that I think are important that parents can address are thinking about how to increase their child's engagement in things, increase positive activities in the child's life. So whether that's through clubs or activities or through sports or through other kind of interests, how to, increase those positive aspects of life where kids can demonstrate their strengths, where kids can have the opportunity to grow and feel like part of a team or part of a club and feel like they have something to add. They gain confidence in that way. That's very helpful. Addressing bullying, sometimes that has to be done more at the level of the school together with the family, but certainly what is appropriate in terms of social communication, online communication, what is not, and trying to have some honest conversations, which is something that I think we're increasingly aware of in society anyway. I think, noticing when children are starting to seem like they're down for a little bit longer is also important, and trying to sort of preempt things getting worse in a way. I've noticed, and you can be a bit of a detective around it. Say, I've noticed that you don't seem quite yourself lately. Like I see that you're in your room a little bit more, or you don't seem to be as kind of jokey or laughing as much as you were. Like, is there something going on? Just sort of early opening lines of communication. I think at school, we have to be thinking about how do we look for kids who are struggling? And that might be socially, but it might be academically too. A lot of school is academic work, and kids are always sort of doing this academic comparison with one another. So being, for schools to really be thinking about, are kids struggling academically? Do they need extra academic support? To try and help kids to feel competent, to try and help them to feel confident that they're able to achieve as well as their peers. I think those kinds of things are really important in kids' lives.
Can I ask you a question that's going to go back to the pandemic discussion? Because you mentioned school and obviously teachers paying attention to academic performance, and performance goes down. That could be a sign. We know that from the pediatric literature. There's also the teams and clubs and things like that, as you mentioned, sense of belonging. And maybe I'm conjecturing too much, but is there a link between what we saw during the pandemic with schools being closed and a limitation on those things? Is that what's theorized to be one of those drivers of those increased emergency room visits? Or is that maybe too simplistic or unknown?
I think there were a number of things during the pandemic that sort of contributed to what we ended up observing with this increase in in distress, an increase in suicide attempt rates. Social isolation was the biggest one. And, where do kids spend all of their time? They spend it mostly at school. And so not being able to feel supported, see their friends. Online was not the same. Online classrooms were not the same. Kids often didn't even speak when they were in online class, right? They just sat on mute and the teachers talked. It's a very different, they didn't do group work. They didn't have one-on-one time with their teacher. So, it wasn't just the closing of the building. There's a lot more social isolation. As you said, they didn't do some of the things that were protective factors. So there was this increase in risk factors of social isolation that was prolonged. Maybe, there's an increase in screen time. We know that screen time is a risk factor for poor mood. Parent stress went up. There were a number of things that were happening during the pandemic. And so at the same time we increased those risk factors, we decreased those protective factors, the social interactions, the clubs, activities where kids demonstrate strengths, to some extent, interaction with healthcare professionals, but I don't think that was as significant as some of the other issues. But we sort of decreased those opportunities for resilience and strength at the same time.
I mentioned it in your bio and you mentioned it again, this connection between depression and cardiovascular health. Maybe it's because Asif and I are South Asian and cardiovascular health is a trigger word for us. It's something that's always looming. Usually it's in the negative and not in the positive. I didn't know about that at all. I've never heard about this link. Some of our listeners might have, some might not have. Can you talk about the link between those two, depression and cardio health?
In community-based studies or in population-based studies, several large population-based studies, we see that having an early onset of a mood disorder like depression in youth is associated with an increased risk of premature heart disease in adulthood. And so kids who have depression are at greater risk of having heart disease earlier and having significant heart disease than their peers who are not depressed. And it's not really understood why that is. It doesn't seem to be entirely related to things like medication use or physical activity or diet, although those things certainly play a part, but it's not entirely subscribed to that. And to the point where the American Heart Association actually designated early onset mood disorders as a tier 2 risk condition for atherosclerosis and for premature atherosclerosis and heart disease several years ago now. And so what we are doing is trying to understand the mechanism of that association. Why is that association present? How do we understand it? Is there a way that we can intervene early when kids are coming and presenting with depression? Can we intervene early on something to prevent a cardiovascular health outcome later in life, even though they're presenting in a completely different setting?
Pardon my ignorance here, Dr. Korczak, but that's kind of what I do on this show. But is it a thing where the more that kids are involved in activities that increase, strong cardiovascular health, do we see less depression in that group, or is it not? Is that oversimplified?
So I think that in general, it's not well studied. It's understudied. And while we know a little bit more about populations and community-based samples, we know very little about clinical samples. So we know a lot less about kids who have depression and their specific risks over time compared with the kids who don't have depression. So like in general populations, we see that physical activity is important for mood and important for cardiovascular health. And so that's one thing that may make sense. We just don't have the sort of the larger, longer studies of kids who actually have depression when they're younger to try and understand that. But that is the goal. That is the plan, is to try and follow and understand these risks better for kids who come to the clinic with depression.
Thank you for your time. And I don't want to take up too much of it. This is the final thing I wanted to say. And I didn't want to mention this off the top because it might put you in an awkward spot. But Asif had told me, and I bring this up because of the work you do and how serious it is, but Asif had told me that you're probably one of the funnier people he's met in his life. Daphne Korczak is a very funny. So I wanted to know sort of about, self-care and self-preservation. You arrive into this world with a good sense of humor. How do you manage that, maintain it, preserve it?
Well, I guess what I would say is that while certainly kids that come are in distress and sometimes in a dark place, as are their parents, I also know that at least the kids that we're seeing are the ones that we can help. The ones that we can, they're here, we can treat them, we can do something about them. I think that knowing that is always helpful in the work. I worry a bit more about the kids that we're not seeing, so the kids that aren't coming. And so I think that is a sort of a core thought that is helpful in this work for sure, is that in general, we can work with kids and families if they come and help them to feel better. I don't know if that answers your question.
Sure. I mean, it's a phenomenon, that so when you have somebody in front of you, you have an opportunity to do something very positive. Dr. Korczak, thank you so much for sharing this. I think you were the exact right person to talk about this subject with. It's incredibly important. It's more concerning than it ever has been, for reasons that you discussed and coming out of the pandemic. So thank you so much for your time today.
Thanks so much for having me. It's been a pleasure to be here.
Thanks, Daphne. So that's our episode for today. Let us know what you guys thought. It's a very serious topic, and that's why we want to get an expert, a Canadian and international expert on the subject. Hopefully you guys found this useful. It was, as we mentioned, a requested topic from listeners, and we want to make sure we did it justice. So let us know what you guys thought. drvcomedian@gmail.com, drvcomedian on Twitter, Facebook, Instagram, Blue Sky. We are everywhere. Ali, what do you got going on this spring?
Why don't you mind your own business? How about that?
All right, harsh.
There's a variety of things that I'm doing, including traveling to the Maritimes and a few other things. Standupali.com is the place to go to find out.
I tell you, Maritimes in spring and summer, amazing. What a great place. Great weather, excellent, great food. You have the seafood when you're out there. So just to wrap up, please remember that although I'm a doctor, as is Dr. Korczak, we're not your doctors. Medical issues we talk about it for your interest and information only, and they're not medical advice. Please consult your medical professionals for actual medical advice. Thanks for listening.
Bye-bye.